motivation has kept coming back to me. People have been asked to give up so much for so long that we risk losing sight of why we are doing this. So I want to talk for a moment about the why. As of now, 3,679 people across our island have died after having contracted COVID. As I stand here, hospitals across the country, across these islands and across Europe are under siege from the disease, with already exhausted healthcare workers now facing a tsunami of infection even greater than the first wave. Already we have more COVID patients in our hospitals than ever before. In addition, we have an even more infectious strain of the virus in our midst. A study by London's Imperial College suggests that the new strain increases the R number by between 0.4 and 0.7, which can rapidly lead to growth well beyond previous worst-case scenarios. That is why we are doing this, and that is why we must dig deep within ourselves and face the coming month with steely determination and resolve. We simply have to suppress this surge and flatten the curve once again. The personal decisions that each and every one of us makes over the coming month will directly affect how many more people get sick and how many more people die. It is as stark and as simple as that. We are in a battle against a deadly and ever-changing virus. The lockdown we are introducing today is designed to reflect that stark and simple reality. Unless you are involved in absolutely essential work, you have no reason to be away from your home, and you simply must stay at home. So from today until at least the end of January, the following additional restrictions will apply, in addition to the full Level 5 protocol. All schools must remain closed, with teaching to move online. There will be 2 exemptions to this. Special education should remain open with protections in place, and Leaving Cert students should continue to attend school for 3 days a week from January the 11th. This has been a difficult decision. Education is the great equaliser and is the single most important factor in the great progress that this country has made since its foundation. The entire school and childcare community has undertaken heroic work over the last year, including the safe reopening of schools and childcare services which took place in September. But while all of the scientific and public health evidence shows that schools and childcare services remain safe environments, the spread of the virus has got to the point where we must simply stop as much mobility within the country as we possibly can for at least the next 3 weeks. Education involves approximately 1 million people on the move on a daily basis. The 2 limited exemptions to disclosure are judged to be essential. Our Leaving Cert students deserve the chance to sit normal examinations this year, and as a government we will do everything we can to make that happen. And while the closure of schools is a setback for all our children, it is particularly challenging for children and the families of children with special needs. While childcare services will close generally until the end of the month, they can remain open for vulnerable children and the children of essential workers. Again, a special tribute must be paid to the construction sector and the construction unions for the way in which they rose to the challenge of making sites COVID safe. However, the same considerations apply, and all construction with a number of exemptions must cease until at least the 31st of January. A full list of exemptions will be published on gov.ie. Government also took decisions today on additional business supports and restrictions on travel, which my colleagues will talk about shortly. As a people, we have responded well to the different phases of this pandemic. We have risen to all of the challenges that have presented themselves. We may now be entering the most challenging phase of all. Personal responsibility and behaviour are the key to getting through it. When even a small minority ignore the guidelines, the wider impact can be incredibly serious. We now have a vaccine, and it is being safely distributed as quickly as we receive it. We welcome the news today that the Moderna vaccine has now also been approved. But please believe me when I tell you that notwithstanding the vaccine rollout, truly enormous damage can be done if we let down our guard against the virus in any way in the time ahead. No one who watched or heard the story of Marita Tarago could fail to have been moved by it. Originally from the Philippines and living in Dalkey, Marita catered for sick patients at St. Vincent's Hospital. She contracted COVID and died on Christmas Eve after almost 20 years of caring for the people of Dublin. That is the risk faced by our families, our neighbours and our friends on the front line of this pandemic. Each of us has a responsibility to do right by them. Each of us must remember Marita and the thousands of others who have been taken by the virus. Each of us must remember this sacrifice and find in our hearts the strength and the discipline to hunker down, to stay home, to follow the rules, and to get this virus under control. Thank you. And I now ask the Taoiseach Leo Varadkar to speak.
Thanks very much, everyone. Cabinet met today to agree a new set of actions to respond to the pandemic. In the last 24 hours, over 6,800 swabs have tested positive in our labs, with a positivity rate of around 25%. So this is bad, it's getting worse, and we're only beginning to see the impact on our hospitals. The restrictions brought in on December 24th and 30th are not yet showing any effect. They will, but even so, we need to augment them now. We're facing into what's going to be a really dark January, a third wave that could be much worse than the first. Hospitals and ICUs not overwhelmed in the first wave are at serious risk of being so later this month. We are much better prepared. We have PPE, we have ventilators, we have more beds, more staff, testing and tracing capacity, and we know now which treatments work and which do not. But none of those things prevent people from getting COVID in the first place. And that's why our message is simple. We have to slow this virus, prevent its spread, and that means staying at home. The restrictions brought in today are intended to reinforce that message and to enable greater compliance. All of this is going to have a huge impact on families across Ireland. More people will be laid off, more people furloughed, many businesses will shut, some for the last time. But government will act to cushion the blow to people's incomes and livelihoods. And today, Cabinet agreed that the pandemic unemployment payment would remain in place, as is at the current rates, at least until the 31st of March 2021 rather. The employment wage subsidy scheme, again, will remain in place, as it is now at current rates, until at least the 31st of March. And the weekly payment to businesses that are closed will continue as well, at least until the end of March. In Budget 2021, we set aside a €2 billion contingency fund for problems that might arise and costs that might arise as a result of Brexit or COVID. We're now drawing on that for the purpose of COVID. Minister Donoghue, Minister McGrath and I are also engaging with the banks in order to ensure that they provide additional payment breaks to mortgage holders and people who have loans who cannot afford to meet those payments as a result of the COVID crisis. But even in the darkest moments, there is always hope, and that hope comes to us now in the form of a vaccine. A second one made by Moderna, approved just today. We estimate that about 35,000 people will be vaccinated this week, mainly healthcare workers, but also some people in nursing homes, rising to 40,000 next week. And with Moderna and a sixth Pfizer dose, that could potentially rise to 60,000 jabs a week in February, and then much more when the AstraZeneca vaccine becomes available. But it will be slow at first. Nonetheless, by the end of March, we have the opportunity to protect all nursing home residents and staff, healthcare workers on the front line, the very elderly and the chronically ill. But until then, and this is the crucial thing, until then we have to slow the virus down so we can get the vaccine to them before the virus gets to them. We need to protect our healthcare staff, our doctors, our nurses, our therapists, our healthcare assistants and our medical scientists. We need to protect our vulnerable, our grandparents, senior citizens and the infirm. And we do so by staying apart and by staying at home. January is the month in which we all stay in.
Eamon?
Yeah, that on a day where the numbers are very stark, that message of staying at home is the key central message. Reducing our movement, reducing our contacts. And when the numbers are very worrying, as the Taoiseach has just said, one number that gives some hope is that the number of contacts people are having when we're checking this, has somewhat halved in the last number of days, gone from about 6 down to towards 3. And if we can keep that moving downwards, that gives us some potential protection. It's vital that reduction in transport, the reduction in travel, the reduction in mobility occurs in international travel as well as local travel here. So at the same time as we're putting these restrictions in on our schools and construction to reduce the amount of travel, we're going to do the same or look to do the same in terms of international travel. We've already done that very significantly. We probably some of the most significant reductions in travel numbers compared to any country, some 90% reduction in overall level of international travel over the last 9 months of this pandemic. On the 20th of December, when the UK government first gave notice, shared their concerns regarding the increased transmissibility of this new variant, we acted immediately in stopping traffic, transport, travel with the UK, closing direct routes immediately. We set up in the interim repatriation scheme using the Department of Foreign Affairs Consular Services. They've repatriated something like 1,400 people in the interim period. But also we've been working with the European Commission, because this has to work on a coordinated basis, whose advice was not to proceed with travel bans, but to use health regulations and use health measures as a way of restricting, but not completely eliminating all traffic. We still need, there are some essential workers, a variety of reasons that people we have to provide connectivity. It's on that basis the government have agreed that we're going to introduce from Saturday, we'll continue the ban until midnight Friday evening, a requirement for all passengers coming from the UK to be in possession of a negative PCR test that they will have acquired within 72 hours of travelling. They will have to present that negative test at the Border Management Unit in Dublin Airport or to a Gardaí at a ferry terminal, and failure to do so will be subject, as a mandatory requirement, will be subject to either a fine, €2,500, or up to 6 months imprisonment. It's a penal provision to make sure we get compliance. It's provisionally set in place to the 31st of January, same with a lot of the other provisions we're announcing here today, to give us time to see how it works and to see what happens with our vaccine. We expect other countries to be doing something similar, and we'll work in cooperation with other countries and with the European Commission to monitor and manage how this affects individuals. Cabinet has agreed provisionally to apply the same measures to other jurisdictions, other red list countries, but we'll first of all introduce the UK provisions, and we'll work in the next week with the European Commission and others, people involved, and apply the same measures from other jurisdictions. This is going to be very difficult for the travel industry itself, is already probably the most hardest hit, for a lot of individuals who may already have plans for travel. As I said, our message comes back to this simple, clear, simple message. At this moment in time, on these circumstances, we stay at home. We restrict our movements, we restrict our contacts. In that way, we protect ourselves. Thank you.
Okay, I think we're... Norbert, you say?
Okay. Thank you, Taoiseach. Just very briefly, from the education point of view, I suppose I would like to acknowledge from the outset that the measures that are being introduced today for the education sector are measures that are being introduced in terms of what we can do to support society in what society needs to do. And we are, as has already been outlined, at a very critical juncture But it is important to acknowledge that right from the end of August, right up to the 22nd of December, schools in the main have always remained safe places. That's the independent analysis, that's the information that has been available, and it is important to note that in that time frame, 75% of our schools have had no interaction with public health. So our schools, independently analysed and referenced by all types of public health experts, are confirmed to be safe places. And the measures that are being introduced today are being introduced as a consequence of a need in society to minimise the movement of society and to reduce contacts. And bearing in mind that in the education sector, we are home to more than 1.1 million people. So that's a lot of people on the move. So the education sector is generously, I would suggest, making this gesture so as to support society in doing now what it needs to do. I'd like to acknowledge also that there are exceptions in terms of the closure of our schools, as the Taoiseach has already said, in terms of the Leaving Certificate students and provision being made also for special education schools and special education classes. I think that's hugely, hugely important. We are very cognizant of the particular needs and challenges of some students, so for that reason special education schools and classes will continue. In terms of our Leaving Certificates, I am very conscious, as indeed I believe all of society is, of the importance of delivering the traditional Leaving Certificate exam as we know it in June. And for that reason, we have been planning in the last while to move in that direction, and the advisory groups have met on two occasions. And the advisory groups are constituted by the partners in education. So that's the student voice, it's the parent voice, it's the teaching unions, it's the managerial bodies, and all of us, as I say, are continuing to work towards the delivery of the traditional Leaving Certificate next June. To facilitate that, there is an acknowledgement that it is supportive of the Leaving Certs to be in school for 3 days out of the 5, and on the other 2 days they will receive remote learning. It's also important to note that all of the students will receive remote teaching and learning in the next short number of weeks. It's important to note also that facility has been put in place right since August in terms of continuity of learning, in terms of guidelines being provided for schools to achieve this, in terms of hours being made available for training for staff. There was an availability of, for example, Croke Park hours being used so that staff within schools could be trained up. There was also provision for students to be trained up. So very strong and very important work in terms of provision of continuity of learning as a provision in case a situation like this would arise has taken place, and I'm confident with the very generous goodwill and cooperation of all involved. And I want to acknowledge the outstanding generosity and goodwill of all of the partners in education and all that work and deliver within school communities. It has been second to none, and I'd like to on the record say that schools have delivered all that has been asked of them, and indeed I would suggest that they have delivered more. And there will be ongoing engagement now to take us to the point that we need to be in the coming days, but I am confident that there is a generosity of heart and spirit that continues to prevail in the education sector, and we will do all that we can do and all that we need to do to ensure that everybody is facilitated as much as possibly can. Thank you.
Gavin Riley from Virgin Media News. 2 questions, if I may. Firstly, on childcare for essential workers. We've been here before. There was initiatives last summer where there was a desire to have creches and childcare facilities open for frontline healthcare workers, and it ended up not happening because the childcare providers didn't believe it to be feasible. So has anything changed this time, or has there been engagement with that sector to make sure that it can take place? And secondly, and I don't know whether either the Taoiseach or Minister Foley wants to take this on, you've said we're in a battle with a deadly and ever-changing virus. You've said January is the month in which we all stay in. But you're also taking the decision to send 60,000 young adults into communal settings 3 days a week, every week, in the midst of the peak of a deadly pandemic. And I'm wondering what makes the desire for traditional state exams so overwhelming that it justifies sending 60,000 people into communal settings 3 days a week? And is it really so desirable to have traditional exams? And have you considered whether, in fact, whatever about it, whether it's safe to hold those exams in June, whether, in light of the ongoing disruptions last year and this, that it would be fair to hold those exams?
Well, two things on that point. First of all, again, the presentations yesterday from the Chief Medical Officer were very straightforward, and from public health in general, that schools are safe places to be in and that childcare services are safe. And that came across very strongly. So the issue here is the mobilisation of so many people. And so there's a big difference between 61,000 coming in a staggered way in terms of 61,000 leaving certificates, as opposed to 1 million, which would involve the entire school population of teachers and students. And I think we know from last year the huge difficulty in developing an alternative to the Leaving Certificate, which is important for this generation of students in terms of their life chances and their future planning, their future career pathways. So it's a very serious issue for them and for this generation. And I think we do owe it to them to do everything we possibly can to try and create and maintain stability in their lives as they approach what is one of the most challenging years traditionally for students. And we will keep that under ongoing review. But I do believe that the objective, and I have to really stress this, the objective of these series of decisions today is to reduce overall mobility within the community. It's been presented to us very strongly that the schools have been safe places to be. And in fact, in the presentations yesterday, it was asserted that the view would be that where children got COVID, it would have been predominantly outside of the school environment. And that's the strong public health presentations to both education have received. And in relation to childcare, we do accept, and Roderick O'Gorman and the Minister will be commenting separately on this. We've closed the ECHE programme, but the provision of childcare is essential to the functioning of essential services, including healthcare. So we want to keep childcare services open to enable workers in those categories to continue to work. And also for vulnerable children, particularly children that have very challenging home lives, that we want to make sure that childcare is available. There are challenges, you're correct. There's no easy solutions to this, and this will be challenging for the sector, but the Minister will be commenting on that further. Norma, do you want to?
Yeah, just to add to that, Taoiseach, again, and I know you will be very tired of this being reiterated, but I do think it's very important for the education sector to receive the acknowledgement that they deserve in terms of all that they achieved between the end of August and the close of schools at the 22nd of December. That all of the evidence and all of the experts, Dr. Tony Houlihan, Professor Philip Nolan, all of the evidence that is available is testament to the fact of the tremendous work that has gone on in the schools, and that schools as controlled environments are safe places. So it's important to remember that has not changed, and the measures that are being introduced are a societal response to an issue that is within society. Secondly, I'd like to say, just in terms of the running of the exams specifically, just to note that we very successfully did run Leaving Certificate exams in November without a hitch, without a glitch, very successfully, and that was at level 5, and as I say, they were seamless in how they were run and how they were executed, and I think that speaks again to the achievement of the education sector to deliver the Leaving Certificate. And finally, just on the necessity to deliver the traditional Leaving Certificate, I'd like to say that we have continuous engagement with the partners in education, and as I've referenced earlier, I refer there to the students, the representatives, parent representatives, teaching representatives, managerial bodies. And it is the overwhelming wish of all that we would return to the traditional Leaving Certificate. It is what the children are being educated for in school presently. It is the objective and the very clear desire of all. So it is for that reason, it is the shared objective of all that we would achieve the traditional Leaving Certificate. And so for all of those reasons, and others indeed, the decision has been taken to facilitate the Leaving Certificates students to return to school on the on 3 days. And again, just to point out in relation to the 3 days, it's entirely at the discretion of the school what way those 3 days will work. You know, they can alternate. It can be Monday, Tuesday, Wednesday, one week, Tuesday, Wednesday, Thursday, another week. There will be complete autonomy within the schools to achieve that. So just to add that to the issue. It is across the board. It's LCVP, it's LCA, and it's established leaving certificate, yes.
Taoiseach, just on the British PCR testing requirement, has there been any contact, or will you give any contact to the executive in Northern Ireland regarding the difficulty with these arrangements, which is the Northern Ireland, the back door, I suppose, to circumventing this sort of situation? Will there be any pressure exerted to try and get the Northern Executive to try and bring in something similar, or otherwise just what's to stop people just flying into Belfast or Derry and coming across the open border?
That is a problem, and I think Eamon can comment on this as well, but there will be engagement and continuing engagement with the Northern Ireland Executive on this, but it's not easy. There are two different jurisdictions, two different political executives and setups, and therein lies, you know, the challenge. But there will be probably the greatest degree of alignment now between Northern Ireland and the Republic on public health issues than there has been for some time. But that remains a continuing challenge to us, and some of the early data coming in on the variant suggests that those who travelled in from the UK over December and who tested positive, that 40 up to now these are very early samples, I stress, and there's a really national programme is required. Up to 41% would have had the variant of concern.
Just if I get back on to some.
Sorry, just repeat that last.
Up to 41% of those who had travelled in who would have tested positive of the strain they had, I think it was 41%. But all this is early analysis, I stress. There was a very important meeting yesterday held after the presentation by NEF representatives to us, involving the need to ramp up our capacity to do the national genomic sequencing as a country and to get real-time data on the prevalence of this variant in the country. Eamon?
The approach we've taken has been a lot of cooperation in the last week, particularly between Department of Foreign Affairs, Department of Transport, Department of Health and Department of Justice. And included in that as well, Mr Foreign Affairs, Simon Coveney talking regularly to the Secretary of State in Northern Ireland, and myself talking to the UK Minister. So we have kind of kept in regular contact, and I said it's important that we do this in a coordinated way. We are responsible for our jurisdiction and putting in these measures, and as I said, the UK government are very well informed and I think supportive of what we're doing. We still have to, you know, they and also the Assembly and the Stormont administration will have to make their call. But there's been a lot of contact across all sides, the Irish Sea and North-South as well. And
just to last, it's of the detection rate of the UK variant in those individuals who tested positive and known to have recently travelled to the UK is significantly higher at 41.3%. So that underlines the importance of this travel.
I have 3 questions. Minister Foley, the ANTO have released a statement just now. They said that the government and the decision made is rushed and reckless. What's your response to that? And just about 2 weeks ago, Taoiseach, you stood here and you were adamant that schools would open on January 11th. Minister Foley, are you confident that schools will reopen at the end of January? Again, to Minister Ryan, a lot of people are scratching their heads here, wondering why didn't the government introduce testing on arrival into the country months ago? Can I ask you why, and who is going to be checking those tests? You've mentioned Gardaí and a border management unit. Has there been people employed to do this? Is every test going to be checked? And then lastly, Taoiseach, can you give us a figure on how many people are going to be laid off, do you expect, and the cost of it's going to cost to the state?
Yeah, just in terms of the decision and the process, I suppose we've got to, all of us, acknowledge that we are living in extraordinary times and a very fluid situation in which we find ourselves with COVID-19. And I think we have to, and we have up to this point, and indeed I would again very sincerely say that we have seen from the partners in education and all involved in school communities a resilience that has been second to none. And I think the responsiveness of government is also a resilience in that we have to adapt, we have to change our ways, we have to be flexible, and we have to meet the situation as we find the situation. And what the situation might be on Monday may not be the situation on Wednesday, and that's exactly the position in which we find ourselves now. But all of us in the education sector serve our students, serve our population of learners, and it is with their best interests that we make the decisions that are being made. But we make them mindful of the enormous support that we have received to this point from all of the partners in education, and very mindful, and I know the partners in education, and I have worked in the education sector all my life, I know that that generosity is consistent, and I know it will be consistent now. I know that there will be challenges and that there will be difficulties, but the resilience of which I have spoken is the resilience that is at the very heart of the education sector, and I know the education sector will not be found wanting in meeting the situation in which we currently find ourselves. Thank you. Our objective is, and I have made the point in terms of the safety of the schools, and so our objective is that these 3 weeks give an opportunity for society to hunker down, to decrease mobility, to decrease the number of contacts that one would generally have. And if society plays its part, I think we all have a part to play now. We are looking at the review at the end of January. Thank you.
Yeah, could I just again reiterate that? I mean, the public health advice is that schools have been safe and are safe. It's around the general mobilisation of the population is the issue here. So we want to keep people at home insofar as we possibly can. The decision, I mean, people are asking for a decision on Monday. They were calling on government to make a decision early and so forth. We took time at this. When I last spoke about education, we took a decision to put it out to the 11th to give ourselves space to consider this so that we wouldn't rush it. And in fact, schools have been closed now since the 22nd of December. So we had time to consider this. So primary schools are closing, bar special education. No, but I just made a point. Schools are school. I don't. But the assertion is that we're being reckless and rushed. But primary schools are closing, with the exception of special needs education. So the vast majority of primary school pupils will not be going to school over the coming weeks.
Can I just on the travel? We implemented in the autumn what was the best practice with our European colleagues, this green, amber, red traffic light system, and with the various measures in place behind it, and worked with other countries and looked to see what was the best practice. What we're doing now is an additional protection. It's not foolproof. Testing itself doesn't avoid risks around false positives or false negatives particularly. So it's not that it gives you complete cover, but it's an extra layer. It's a layer on top of the existing provisions. And we're going beyond that red traffic light system, the Department of Health has said, as we did previously when there was a Danish strain outbreak, but now in relation to the UK, we're saying that we go beyond that. The guidance is to self-isolate for 2 weeks, even with that PCR test, even with it showing negative. And it's important that we follow public health advice. So this is only an additional measure, but it's important. We felt it was important, given the severity, given the need to restrict our movements, restrict travel, protect ourselves as best we can, to put in additional measures. That's why we're doing it now. It's because of this very unique circumstances in the spike of numbers and the concerns around the variant. It's an added layer of protection to what was best practice. Every person, the reality is the number of people travelling at the moment is a trickle. As I said, over the pandemic, typically it's been down 90%. It's even more dramatically reduced at the moment, down to negligible numbers. So every person arriving, as they present their passport, will also have to present the negative test. Everyone at Ferryport will have to present the same to a Garda Síochána. We can manage that on a person-by-person basis because the numbers are going to be so small. They're fined. It's a €2,000 fine, subject to the guards. They'd be referred to the Garda Síochána, and they have the provision to fine or imprisonment. It's a prosecutable offence.
Yeah, I can't give you an exact figure because some people laid off will take up work in other areas, and some will be furloughed. They'll be put on the wage subsidy scheme. But to give you a rough idea, the number of people on the pandemic unemployment payment back in early December was under 250,000. With the closure of hospitality on the 24th, non-essential retail and leisure on the 30th, and construction now, we anticipate that by the end of the month it could be between 450,000 and 500,000 people in receipt of the pandemic unemployment payment.
Craig Hughes from the Irish Daily Mail. Minister Foley, did you seek to bring the junior cert students back as well? And can you tell us clearly what was the CMO's advice to you in relation to education? Taoiseach, are we going against the CMO's advice on travel? Can you tell us what exactly did he say there?
In what respect?
In terms of the travel ban with the UK, was the CMO looking to have that extended? I know you're relinquishing that at the end of the week. Would you have preferred that to keep going? And finally, what was the CMO's advice and presentation in relation to hospitals? How concerning is the situation there at the moment, and what did they say in that regard?
Norma?
Yes, Taoiseach, thank you. Well, just in relation to the advice and the view that is expressed, again, and I apologise for repeating myself, the advice and the understanding of our schools is that all the analysis and all the data shows that between August and close in December, that schools have been safe places due to the work, again, acknowledged by school communities, and that they are safe environments. However, there is an acknowledgement that in society there is far too much movement, and that we need now to, and this is the view that's being expressed by the CMO, there's a need to reduce mobility, there's a need to reduce contacts, and bearing in mind that the education sector generates the movement of more than 1.1 million people, it is for that reason that we would look at, that we are looking at the measure of reducing that movement and implementing the measures that I have referenced. In relation to the junior cert, again, if the general overall aim is to reduce movement, then we must do just that. And so we looked at those that I wish we could prioritise everybody in that respect, but we can't. We are, I believe, in the education sector very generously doing something for the benefit of all of society. And so within that, there had to be an element of priority, and the priority has been given, as has already been outlined, to special education facilities and special classes and to the Leaving Certificate students. Notwithstanding that, in relation to the junior cert, obviously education continues for all of the school population, and it will continue online, and I have every confidence that it will be delivered well online.
What I'm looking to get at is, did you seek to bring the junior certs back as well? And CMOs would allocate that too far?
No, this decision is a cabinet decision in terms of who's been brought back and how schools will operate for the next number of weeks. It's a recognition of the view that we need to reduce mobility, we need to reduce the number of contacts, and that's why the decision has been taken.
Just on that point, that the CMO wrote to the Cabinet, or to the Minister, for Health yesterday prior to the Cabinet subcommittee meeting. I would have spoken to the CMO myself the day before in relation to schools. And in his letter, he's very clear that the full reopening of schools would create a considerable risk at a time of very significant high levels of community transmission already. So he's very much in the context of the full mobilisation of the million people. He's equally very clear in his advices to us in presentation that schools have been safe places. And in fact, the phrase is used that the outbreak in schools has been very small in terms of the outbreak in school settings. And in terms of hospitals, his main focus was on the pressure on the hospitals and on the intensive care units, and essentially saying that we needed to radically reduce transmission and incidence. And the most effective way to do that was protect each other, and the most effective way to protect each other from serious illness, to protect our health services and healthcare workers, is to stay at home. That was his essential message. And on education, he didn't go specific to Leaving Cert or specific to Junior Cert. It was that if you brought back the entirety of the school population, because of the transmission rates being so high in the community, that in itself would constitute a risk. But that was the advice. So this is in line with his advice, and we'll be keeping, last evening, after the meeting with us, they had a further meeting then of the NVRL and the HPSC in relation to the variant and doing a risk assessment on that. And they've reported to the Minister for Health in relation to that today. And there will be increased ramping up of capacity to get the real-time data on that. So basically the CMO's advice is there's rising pressure out there. If we don't act, that pressure will only get worse and there'll be very serious consequences, so we need to act.
And just on the travel side, just to answer that, the concern there is about all travel, as I said earlier on, and a desire to reduce and restrict travel. As I said, the measures we were putting in place were worked together with Department of Health and Justice and Department of Foreign Affairs, and that's the way that we work at that. Health, which makes up most of an effort, has been involved in the decision making in this for the last week, 10 days.
What does the CMO say on that point on the international travel?
Just raise concerns about travel, but not anything on the specifics of this measure or any other measure, but just a general concern, which is why we keep coming back to this message: stay at home, reduce contacts, reduce mobility.
He did make an additional point that he would support these measures and would not agree with those who would say, well, the horse has bolted already, the variants in the country, do you need to be doing this? I mean, his view is you do everything you possibly can to suppress the growth of the variant, and one of those tools is restrictions on travel, particularly from the UK. So he would be supportive, I think, in terms of anything we do that would restrict travel at this stage. That's legally robust.
My final question was on the hospitals and the CMO presentation to you last evening. Can you just give us some details on that?
Well, as I said to you, I mean, basically, I think the details are out there in terms of the numbers in hospital at the moment at the HSE. His basic essential message to us: the graphs are rising. Have been over the last 2 weeks in particular. There's been very, very rapid growth, and in my discussions with Paul Reid as well over the last 4 or 5 days, it's exponential. It's no modelling scenario envisaged the level and rate of increase. But their view is if we take these measures on top of the measures we have already taken in terms of going to level 5, that will turn the corner for us in terms of community transmission, but that we need to take them. And to reduce the pressures on our frontline workers in our hospitals. That's the essential message from Philip Nolan, who did some modelling and presented some various scenario models to us. You could have up to 1,500 to 2,500 people in hospital if we don't take these measures. And you could have significant increases as well in ICU from 200 up to 400. So these are very serious presentations, and that is why we're responding. And these measures are radical in terms of requiring people to stay at home and reducing mobilisation generally.
And just a few quick issues. Minister Ryan, first of all, the PCR requirement for people who are coming from not from the UK or from South Africa, that's going to be extended. When is that going to come into force? Also, is there any kind of fee rebate being examined for families who won't be able to send their kids to crèches, for example, if they're not essential workers, or perhaps essential workers who choose not to send their kids into crèches? Is there a level of infection which has been identified, or a level of transmission of the virus which has been identified, where we might be reasonably expected to go back to work or to have more kids back in school? Is there any kind of threshold or target that has been picked out? And then just on Moderna, do we know when that's coming into the country?
Yeah. Do you want to take the travel?
Yeah, that's the first question. Firstly, South Africa, so I should have made clear, is included travellers from South Africa with immediate effect, same as the UK. In terms of applying it to other jurisdictions, we want to go back, talk to the European Commission and the travel operators and the other governments and make a decision in the coming days, week.
Yeah, in terms of the fee rebate, in terms of essential workers for childcare, I think Minister O'Gorman is examining that and will be coming back on that specific issue that was discussed at the Cabinet. And in terms of is there a particular threshold or level? Not yet, and we'll keep this under review. I think what is the key objective? To flatten the curve, to get the trajectory of community transmission down, turn it around, and get it travelling downwards. That is the key objective of these measures. And that is why it's essential that everyone stays at home and cooperates with this. That is the overwhelming objective. When we get there, we'll assess where we are, because the vaccines are being rolled out. Moderna, we don't have a clear timeline as of yet, and I spoke, Breenley Cra made a presentation yesterday, the chair of the task force, on the Moderna rollout. But again, the numbers from Moderna will be an additional help on top of Pfizer-BioNTech. They're not huge numbers yet, and we don't have a clear timeline in terms of their release to us. But they will be. It's good news nonetheless, because prior to that authorisation, the target was by the end of February to have all of our residents and workers in nursing homes vaccinated, and up to about 70,000 in healthcare settings. The AstraZeneca process is very, very important as well in terms of this race, if you like, and this battle against the virus, because that gives us greater room for manoeuvre, as I said before, in terms of decision making, in terms of sectors of society.
Taoiseach, takeaway drinks became a bit of an issue in the last lockdown. Takeaway drinks or takeaway pints, as they might have been known. Will they be allowed this time around? I note on gov.ie that food is just mentioned. Is it the case that they're not allowed this time around? And then, Minister Foley, is there a framework in place to guide the reopening of schools for children with special needs? Will it be like July provision, for example? And then the Children's Ombudsman expressed concern around children from disadvantaged backgrounds, and DESH schools will now be closed. Are there measures in place to alleviate the pressure there? And finally, Minister Foley, for children of essential workers, they won't be allowed to attend school, will they? So are there measures in place to help arrange care for those children? There were reports of bubbles. Are they true? Thank you.
First of all, look, forget about takeaway pints and takeaway alcohol, and no publican should be selling takeaway pints. This is a very serious situation we are in. It leads to congregation. It leads to gathering of people, which can spread the disease and the virus. And that's a very, very clear message from me and from government in relation to that. And Norma, do you want to take the July provision?
Yeah, just in terms of the operation of the special schools and special classes, they will operate as they've always operated. And that was the provision when we were to return to school. They would operate in that respect. But specifically, you asked about the July provision, which was very, very successful last summer, and it would be our aim, obviously, to continue the July provision next summer. But schools will operate. It is our intention that schools will operate as they are currently operating. In terms of students who might have particular challenges with disadvantage and that, again, recognising that you know, we learned a great deal, I would say, from the previous lockdown, and there would have been issues, for example, in terms of access perhaps to technology and equipment and all of that. And in acknowledgement of that, and in acknowledgement of the digital strategy that exists within our schools, substantial funding has been made available. This year alone, 100 million, and in December, in fact, 50 million disseminated to the schools in terms of purchase of equipment, and that was specifically referenced, the purchase of equipment throughout the year, or you know, equipment that could be loaned to students who might need equipment, or any technology that might be needed within the schools or whatever. So just from the technology point of view, that provision is there. In terms of also outreach to students who might be in particular, I suppose, need of particular encouragement or resource, that facility is also there, and within the guidelines there is an acknowledgement that every school has within the school a pastoral team, a support team, and that there would be designated person or persons who would make particular contact with those students. And of course there will also be provision through the homeschool community liaison officers who will also be involved there. And like the objective, as always, will be that students will be fully engaged, that they will be resourced, as I have said, and that they will be very much part of the education experience. And finally, just in terms of the bubbles for workers, and yes, indeed, and Minister O'Gorman is looking at childcare issues around that as well. Well, there is potential perhaps for families to form a bubble with one others, or you know, a variety of, or a suite of measures will be looked at. But specifically, there is an opportunity for a bubble to be formed with one other individual or family that might be able to support those who are essential workers.
Yes.
Adam Higgins from the Irish Sun. Taoiseach, in March, we were one of the few countries who closed construction. And again, this time around, we're going to be one of the few countries in Europe to close construction. Why are we going against the grain on that one? Are Irish building sites less safe COVID-wise than elsewhere in Europe? And then secondly, on the same issue, there will be a lot of families who are waiting to move into their new home that they've bought, and that move-in date will be pushed and they'll have to scramble to find somewhere to stay now until whenever that building is finished. Is there any message for those families?
Well, first of all, the sector has been exceptional in terms of how it has organised itself, in terms of safe protocols, making sites safe. That is acknowledged. This is not a sectoral issue. This is a societal approach. In other words, reducing overall mobilisation. About 200,000 people involved in the construction sector. We realise how severe a measure this is. But it's in order to achieve the overall societal objective of getting the virus down as quickly as we possibly can, so as to relieve pressure on the hospitals and ICUs, and just to prevent people from getting sick and people from dying from this, that motivates this decision. There will be some exemptions. People who are, for example, if the house is nearly finished and complete, they'll be allowed to complete the house to go in and live. If it's necessary to render a house habitable, that will be facilitated. The voids, for example, that are near completion, the work that was done there on about 2,500 voids, now most of those are completed, but the few of those will be allowed to be completed as well, or sorry, the remaining number of those that remain to be completed. But it is a tough measure on the sector. We acknowledge that. It's not a judgment on the sector, it's a wider push by us as a society to get the transmission of the virus down and to protect human lives and to prevent people from getting sick.
So if the construction site is almost complete, say, for example, finishing a snag list or something like that, they'll be allowed to complete that work?
Yeah, the snag list isn't an issue at all. Yeah, of course, if there's some internal utilities like electrical installation to finish off a house, that will be allowed. And some social housing outputs as well. Yeah. Thank you indeed.
Stephen Murphy from News Talk. Just in relation to travel, can I clarify, will you have to have the test within 72 hours of travel, or just to have the result within 72 hours? Because NEFIT has said, a test is only as good as the time it's taken, so why didn't we look at something like a mandatory quarantine?
No, it'll be a test within 72. You have to have the result. And if it's right, that tends to be the international practice. They said is the timeline, so it can't be greater than that. Quarantine it would be very difficult. People cite New Zealand or other, but we have this, I suppose, this physical reality. We live in an island with a border with Northern Ireland, and the ability to completely seal off in that regard isn't possible, isn't open to us. So that's why we're taking the approach we're taking.
And Taoiseach, you've said it could be the end of March before healthcare workers, the elderly, nursing home residents and staff will be vaccinated. Do you think that the likes of pubs and restaurants, which we know lead to super spreader events, might need to stay closed until then to prevent another surge? And Taoiseach, you've talked a lot about the variant. NEFIT has estimated that it wasn't introduced here until the start of December. Obviously, we know that at that point you went against public health advice and opened up hospitality. Do you now accept that that was a major factor in the reason schools are not opening next week?
To just answer your questions, I think as the Taoiseach was saying yesterday, by the end of February we would anticipate being able to vaccinate anybody who lives in a nursing home, all of the staff there, and healthcare workers who are on the front line, who are exposed to patients. Then moving on in March to the very elderly people over 80, those with chronic illnesses, those who are most at risk. That's with Pfizer and Moderna. If AstraZeneca comes in and becomes available, we can step that up and step that up more. But that's the current timeline we're looking at. It's very, very hard to make predictions and projections. I think any time you do when it comes to dealing with COVID, there's about a 50% chance you're going to be proven wrong. And this is a virus that has torn up our plans on many occasions. But speaking as the Minister for Enterprise to people who run a business, if I was running a business now, I would be thinking that there's a probability that I'll be closed until the end of March.
Yeah, could I just say, actually, there was an important meeting yesterday where people put together a lot of data around this variant, and actually looking retrospectively at some of the some samples, it actually was first detected in early November. and we haven't had a comprehensive, national genomic sequencing. So we just need to be very careful. And I don't, the variant is a huge concern to me because of potentially what it can do. It's estimated its infection, transmissible rate is at 50 to 70% more transmissible than the virus itself. We know in the UK that even where restrictions were in place in Kent, the numbers didn't come down, and that's why they began investigating in the UK, and they discovered this particular variant. So it's very serious in terms of its resistance to what we would call normal restrictive protocols. And so, I think it's a very worrying factor amongst a whole range of worrying factors. And when we talk about, we had come out of a level 5 for 6 weeks, but if you look at the whole trajectory from the beginning of the pandemic, Ireland actually has had significant restrictions from the very beginning. They were eased somewhat during the summer, I think, to level 2-ish, but for a very brief enough period. Back up to level 3 max, level 5 for 6 weeks. There was agreement broadly that we would move to level 3 for December. That in itself, when you move to level 3, increases socialisation across the board, not just on hospitality, but everywhere. On the streets, non-essential retail, you name it, right to personal services, and so on. And actually, we've been very aligned over the whole 9-month period in terms of the advices we've received in public health and the actions that we've taken. If you look at it over the period. And what the lesson really is that the virus, as I said in my opening remarks, is ever changing. And I think there's increased capacity now in terms of testing capacity, particularly the testing technology required for this variant is in the next 2 weeks will be put in place, a new laboratory. It's envisaged that the NVRL with the HSE will now open specifically to deal with this, to get us the correct, not correct, but up-to-date real-time data on the prevalence of this variant. So I wouldn't understate at one level the challenge, not trying to find out what it was there, in early December, November. We now know it is. We now know how it spreads exponentially. We now know how it actually becomes the dominant variant as it has in London. But the real issue for me now is it's the public health message that should emanate from the fact that we know this highly transmissible variant is in our society. That's the key issue. That will have to inform policy decisions by government into the future and the rollout of the vaccine. And it also has to inform the kind of decisions that we're taking today, along with the other clear issues of the high hospitalisation. And if you look at what's happening here, it's not dissimilar to what's happened in the UK in terms of the rapid growth in community transmission, rapid hospitalisations. So, I'm very worried about it, if I'm honest about it. That is something that really worries me. And that is why we do need to roll out the vaccination programme as soon as we get the vaccines. As we get vaccines now, we will be rolling them out, we will be injecting. The only issue holding back vaccines now, or vaccine programme, will be the supply of vaccines into the country. And so it is an issue of concern to us. I read the report of the Imperial College of London last Saturday morning, and that there are serious conclusions that emanate from that. There'll be further analysis of that by academics and virologists and so on. But suffice to say that it's a serious issue for us that we cannot ignore.
If they were on the same track as the UK in terms of the hospitals being overwhelmed?
No, I think if we take action today, and that's what I said earlier, if the Irish people, and if we all as individuals, if we adhere to these guidelines and rules and regulations and just shut down, hunker down, stay at home, we can turn the tide on this. And it will be challenging, but we can do it, and that's the key message. And avoid and protect our hospitals.
Can I just say, in case I put the heart across people, we will review the situation on the 30th of January and make decisions on restrictions then. But the situation is deteriorating. It is very bad. It is going to get worse in our hospitals and our ICUs. We're not going to be out of the woods by the end of January. And that's why we're putting in place the pandemic unemployment payment, the employment wage subsidy scheme, and the weekly payment for businesses that are closed at least until the 31st of March in case things go on that long. And I think anybody in the business community needs to be prepared for that possibility.
And just last point, if I just add what Taoiseach was saying, I thought Ronan Glynn put it very well the other day. We can all look back 3 weeks, we can look forward 3 weeks, look at the now, and the now is about staying at home and staying safe. I think his was really good advice. You mentioned you've been engaging with the banks on loan and mortgage payment breaks. Have any of them given a positive answer to that they will introduce it? And what are you saying to them to encourage them to do so?
Yeah, well, it's mainly Pascal that's been doing that, but I spoke to him about it today, and there'll be a further engagement. So, essentially what we're asking of the banks is that where somebody can't pay their mortgage or where somebody cannot meet a business loan during this period, that loan breaks are reinstated or loan breaks are extended. And he says to me that the feedback from the banks has been positive in that regard. It won't be a blanket payment break, the likes of which existed last year, but for those who cannot pay as a consequence of being closed or being laid off as a result of government order, we'd be saying to the banks that we'd expect them to look at those cases very favourably.
Yes, yes. I mean, look at it, we're saying, look, there's no one should be selling pints on the streets right now. No one should be gathering on the streets right now. It's stay at home is the message. No, we're saying stay at home basically is the message in relation to this. No, off licences will open as normal, but we're saying that we know the pattern that developed. Now, in fairness, I've been talking to the Guardian on an ongoing basis in relation to this. You know, Stephen's Night and New Year's Night, there was general societal adherence, and there weren't any particular problems manifesting as a result of this, as towards the end of November somewhere. Okay. Yeah. I know that. Yeah. Well, there's a well, yeah. No, or you can do regulations in terms of gathering as well on the streets, which can protect people gathering and so on. But what I said earlier was a clear message, because of the message is to stay at home. I'm saying to publicans, it's not on that anyone will be selling pints. Forget about selling pints now on the streets, that's the point I'm making. To avoid the gatherings that did occur, and which can facilitate the spread of the virus. You know, if you have 200 people on the street, or 100 or 50 and so on, that can spread the virus. That's the message. It's simple. Yeah.
There are a lot of people saying that their childcare providers or their crèche are already asking for payment for January to maintain the place for a service that obviously they are not going to be able to provide because their profession isn't an essential worker. Should childcare providers be allowed to charge for a service that they can't provide to them?
I think the Minister will be engaging with the childcare providers and with the sector to iron out these particular issues. And obviously there's two issues there. There's the person who's using the service and paying a fee for a service that isn't provided, but also there's the continuing viability of service providers, which is essential to us all in terms of how society evolves. So the Minister is examining all of this as a report to the Cabinet today. Yes, as of yesterday, again, they were very clear they would be administering 35,000 this week to hospitals and to nursing homes. And they're, I think Professor Queen-Burt was on last evening articulating that as well. And they now have a far higher level of assurance in terms of delivery from Pfizer-BioNTech for the next 2 months. So their view is it will be about 40,000 per week after that. And their intention is to give weekly updates in terms of the amount of vaccinations and the number of vaccinations administered.
What's causing that language? It seems bizarre that they don't know themselves. They just see that last night.
Well, they do know. I mean,
they wouldn't tell me how much they done on Monday, which leads me to believe that there's an issue with computer systems and there's studies in paper in a lot of instances which are bizarre.
Yeah, but I mean, their view to us last evening, they think it would be more advantageous to do it weekly, more sensible in terms of putting data in. But there'll be 35,000 administered this week, and there's huge take-up or demand from the hospitals, from the healthcare workers. No issues there in terms of taking it on. So the issue really for vaccines is the availability coming into the country, and that's the big issue. The supply lines into the country, and that's the only thing that will hold us back now. In terms of vaccinating people, that's all. I mean, they've made it very clear to us as soon as they get vaccines in. I've been talking to Paul Reid on a daily basis on this, and to Breen Nicra and others as soon as the vaccines come in now, they'll be injecting. They'll keep a buffer back in terms of if there was any supply chain interruptions, that we would be able to give the second dose. But it's only, it's not the full second dose that's been withheld because they're now more certain of the supply lines from Pfizer over the next 2 months. And that's reassuring. But no, Moderna will help us and will give some additionality to that. We're hoping that the AstraZeneca process will get speeded up, because that would be a significant game changer in terms of volumes and in terms of ease of administration of vaccines. And that would be a very significant, I think, advance for us if that emerges. We're keeping an eye on that, very close eye on that. Thank you very much. Thank you. Thank you. Thanks.